Menopause is technically defined as the point of your last period, but symptoms can start before that in the time leading up to that, called the perimenopause. And essentially that's when periods start to become more irregular and your hormones start to change. We think the reason women go through these changes are because of the fact that the ovaries are not producing eggs regularly. As they become irregular, your hormones start to go up and down, and that's what causes your symptoms, those fluctuations in your hormones. The symptoms for menopause are vast. They can range from the common ones like hot flushes and night sweats, and mood swings, but you can always also have things like joint pains, dry eyes, dry skin. Psychological symptoms can be quite common, so mood changes, anxiety, loss of confidence, brain fog, loss of concentration. Those are really common ones. Loss of libido, urinary problems as well. So that the symptoms are really, really vast, essentially because we do have estrogen receptors all over our body, and the lack of estrogen that we see in menopause can cause a variety of symptoms. Yeah, so it's really important to be aware of the long-term effects on health with menopause. Yes, of course, there's the short-term effects which can affect a woman's well-being, mental health in the short term, but the long-term effects are also really important. As we lose estrogen, our bones can thin, it can affect our heart, it can affect our brain. So to look at ways of protecting our heart, our bone, and our brain is really, really important for our long-term health. So menopause is actually defined as that point from your last period for essentially the rest of your life. But the symptoms, which is what really bothers women, those tend to last on average 7 years, but they can last a lot longer in some women. You'll get a few women who will absolutely sail through the menopause and have a really short bout of symptoms, and very few who don't get any symptoms at all. The most effective way of treating menopause symptoms is hormone replacement therapy. And the main hormone that we replace is estrogen, but testosterone is also a female sex hormone, which sometimes needs to be replaced. And that, I would say, is your gold standard way of treating the menopause. But treatment has to be holistic. We look at nutrition, we look at psychological well-being, because these are factors that we need to address for the most effective way of managing symptoms and also long-term health.